Okay. So, good evening, everyone, and welcome to today's session on clinical data science with Python. Before we begin, I'm delighted to introduce our SME for today's session on clinical data science with Python, Mr. Ashish Saha. Ashish is an accomplished data science and NASCOM certified trainer with extensive experience in delivering corporate and academic training across India and the US. He has worked with organizations such as ICICI Bank, SAT, Cyber Technology, Super Procure, Techno Potent, Lovely Professional University, and Genesis, delivering hands-on sessions in Python, machine learning, advanced Excel, Power BI, and data science. Ashish brings deep industry experience across the medical domain, cruise ship analytics, and enterprise data systems, where he has built models for medical insights, corrosion detection on ships, and large-scale forecasting. So, with this, his strong ability to simplify complex concepts through real-world examples, Ashish has been trusted consultant for various edutech firms. So, we are excited to have him lead in today's session, and please join me in welcoming Mr. Ashish. And so over to you, Ashish. We can get started.
Thank you for introduction. So, hey everyone, welcome to the session. So, in this session, our main agenda is that what is the use of data science in clinical medical field that we're going to discuss in today's session, like how in today's world, like AI and data science is growing in different domain, and we have one domain that we're going to discuss in today's session, and the domain name is medical field. So let's share the screen and start the session. So here we're going to discuss how data science is used in clinical domain. Yes. So clinical data science, if I talk about it, it combines healthcare data with analytics method. It supports decision making clinical trial, hospital, pharma, and for public health. So there's a lot of use of data science in clinical domain. Let's see if I talk about the business use in medical domain or clinical domain. So we in day-to-day life, like we have a lot of transaction in our hospital. Some diseases our hospital can care by the doctor, or maybe some disease is not cared by the doctor. Maybe shortage of doctors. Anything can be the reason. Sometimes medicine, like we have a medicine, so our customers is coming for buying the medicine, but due to stock is not available, we are not able to provide the medicine. On that case, hospital is getting the loss. So so here I show you two example. So this is a business related example. Like in that way, business related things, our clinical domains are going handle the business. If I talk about the technical field, so let's see, in our today's world, like we are getting a AI model, like who find the like the patient have the cancers or not, the patient have like different type of diseases. So our AI model can automatically detect if the person have this disease or not. We saw more AI model, like I think maybe you heard, like we are giving our requirement, like I have these type of illness in my body, so please give me some medicines. So our AI model is automatically like based on the descriptions that you provided to AI model. My AI model is automatically give you the medicines, prescriptions, and all. Like you can follow these medicines and take it. So I hope you have heard about these type of AI model is already present in our market, and our AI is still growing in our medical domain. So it needs some time, but obviously, like in the upcoming time, most of the works is done by the AI. So you have heard about that AI is replacing AI is doing the heart transplantation and all. AI is detecting the person has the cancers or not, like different type of diseases the person have, and AI can automatically detect if the person have that type of diseases or not. So here in that way, I show you like business field in that way, in business field as well as in technically that is taken over the doctors and all. So AI can, or we can say data science can handle both work. So data science basically is not like a person. It is basically like our assistant that can help me to assist to take a decision. Suppose the persons come to me, and I take some test. Based on the test, I decided that the person have the cancer. But due to some reasons, maybe any cause can become, I am not able to decide that ki person should go with the cancer treatment or not because I'm not sure with it. But here, AI model, when I give my the test report of the person, the test report to my AI models also help me and it detect that ki the person has the cancer. So here, AI help me to analyze the test report in deeply and give the decision that ki the person has the cancer. So here,
Ashish, sorry, Patil here. Can you do it in the presentation mode, the PPT?
presentation mode. Okay,
Yeah.
sure.
Yeah. Sorry to bother. Yeah, thanks.
I hope it is now visible.
Yeah, yeah, thank you. Thank you.
So now here, AI, when AI give that AI predict that the person have the cancer. So on that case, doctor is properly now this time 100% sure that the person has the cancer. Now the person can go to the cancer treatment. So similarly, lot of data science is working in clinical domain is already going on in day-to-day life. So in today's sessions, I'm going to discuss like what type of work is taken by the data science in healthcare industries. So as we discuss clinical data science, generally it combines healthcare data with analytics method. It supports the decision making in clinical trial, hospital pharma, and public health. So as we discuss the decision making means like for example in decision making like that the person cancer. So doctor have decided the person the cancer based on the test report that are provided to AI model. The next one is that it improves the patient outcomes, it reduces the cost and increase the efficiency. So here, with the help of the data science, what we can do, it helped me to improve the patient outcome, like the person, what type of disease that person have. And it also helped me to reduce the cost because suppose we have an AI model that basically help me to know the what type of diseases the person that have. So maybe if my AI model is work better, so I can keep in my AI model in my healthcare industries that basically reduce my manforce work. That basically helps the doctors to reduce their workload. So in that way, data science can help me to in clinical data field. So I hope these 3 points are clear to everyone. Now let's move to the next point. Here, I give you some example of clinical data. What is clinical data? Here, in clinical data, we found like patient demographic, like the patient age, gender, heights, and all. The medical history of a patient, the person have disease or not, like that. Lab test result, electronic health records, clinical trial data, medical image data, wearable sense data. So these are like normal clinical data in which I can work or my AI model can work easily. So let's see what type of problem that data science can handle in this domain. It can find the early disease detection, the person that have disease or not, personalized treatment plan. So in today's world we can make an AI model that basically personalizes a treatment plan based on the person diseases. Clinical decision support, it basically help you to take the decision to like that case should the person have cancers or not, like that we have discussed. It monitoring the patient progress. So we, as we know, in our hospital, when the patient is on bed, so there's some reports are there. So when you are giving to this report to my AI model will detect the person have diseases is improving or not. If it going well or not, that is also going to be predicted. The next one is that predicting treatment effectiveness. So the peoples have different type of diseases. So here AI model can help me to predict what type of treatment that person can have and the person is effective or not, like that. It also improves the clinical trial design. So basically the clinical trial that is coming to our healthcare industries, it can help to improve the trial. So basically, for example, clinical trial, for example, like medicine. So I want to know that I launch a new medicine that improve or that cure my fever within like 10 minutes and all. So I want to know like is this decision is correct or not? Should I launch the medicine or not? So data science help me to take this decision. Should this medicine should I launch this market or not based on the statistical test and all. So this is example like how data science is help in clinical domain. So I hope everyone this point is clear. Now let's move to the next point. We have some key data science techniques that basically help me to analyze the data. First one is descriptive analytics. In descriptive analytics, basically we try to find what type of problem that person have, right? Second one is predictive analytics. So in predictive analytics, basically we trying to predict the future based on the past pattern. The next one is prescriptive analytics. In prescriptive analytics, we trying to give the prescription. The person that have diseases, we trying to give some prescription. So here we have these some techniques that is available in data science field that basically help me to solve the medical domain problems. The next one is natural language processing. NLP processing means basically here we take a text data and based on the text data we perform the analysis. For example, the person are giving the description in normal text language and I want to analyze that what type of disease that person have. So here NLP technique can help me to convert my text into normal coding parts and all that my machine can understand. The next one is time series analysis. So time series analysis basically help me to analyze that the person will improve or not. So it is totally based on the time series analysis. So here that is some key data science techniques that we have discussed. Now let's move to the next point. Let's see disease prediction. So what are disease prediction that data science can do? So it can predict it can predict the patient will develop diabetes or not. The patient will have diabetes or not. So for that type of model, we require data that contain age, BMI, glucose, family history, and all. And what is the machine learning model that I can use it to solve this problem? We can use these algorithms like logistic regressions, random forest, or XGBoost. So basically, the outcome of my model is that it will predict the person have a diabetes or not. So that type of problem that I can develop with AI model in data science domain. So I hope this first case is clear. Now let's see the second case. Second case is clinical trial optimization. So it basically improves the patient recruitment. So basically, based on some method like clustering eligibility prediction, it basically helped me to understand the patient recruitment process. The benefit is that it fast recruitment and reduce the cost and higher the success rate. So that is the second use case in the clinical trial optimization. Now let's see the next case. Next case is medical imaging analysis. So here, what happened? First, suppose I want to make an AI model that will detect the tumor, that will detect the fracture from the X-ray. So that type of problem I can easily solve with the data science. So basically, for this technique, we required CNN and deep learning. So CNN and deep learning techniques are the technique with the help of which I can make an AI model that will detect that the person having the X-ray have the tumors or not. Or in the X-ray, it will detect my AI model will detect the way the fractures, fracture identification, organ segmentation, and like that. So that is the application of my medical imaging analysis. So this is the third case that in that way AI model can help you. The next one is that here to create an AI model, we need to follow some steps, and that step is called data pipeline. Now let's come to what is data pipeline steps. So here in data pipeline, we have to follow some steps to make an AI model. First one is data collection. Second one is data cleaning. Third one is data integration. Fourth one is EDA. Fifth one is feature engineering. Sixth one is model building. Seventh is deployment and monitoring. So basically in data pipeline, what we are doing, we are going to collect the data and clean it, and then we integrate it with our AI model steps. Then we do the EDA. Basically in EDA, we're trying to perform the analysis on our data. Then we do feature engineering, like to create some new features based on the data that I have. Then we apply the AI model. So after the once the AI model is built, I can deploy in my websites and all. So in that way, data pipeline is the most important part to make an AI model. So I hope data pipeline part is clear. Okay, now let's move to the next part. Here, what are the tools that we are going to use to make an AI model? So we required first one is Python. Python and between Python and R, it is optional. You can use anyone. So we recommend Python because industry is using Python and Python is easy to understand and it is better than R. The next tool is that Pandas, NumPy, scikit-learn, and TensorFlow. Then after that, SQL and NoSQL. Between that, you require only one SQL. Then Tableau, Power BI. Power BI is and Tableau both are used for the analysis purpose. So any one tool you can use it. The next one is CD6, SAS, Medidata, and RedCap. So here, these are the some tools that we're going to use to make an AI model. So I hope this tool is clear. The next one is what are the challenges that we're going to face? So the challenge that we're going to face in generally in medical domain, first one is missing data. So the data that I'm getting in the real world, it is never in proper clean format. It is like lot of null values, lot of outliers are there. So what we have to do, we have to handle these things. So we have to handle the missing values. We have to clean the data. We have to handle the privacy restrictions, data integration issues, like integrate our data with our AI model and clinical validation is needed. So we have to follow some clinical rules, and our data we have to should transfer in like in terms of clinical format. The next one is interpretability issues. So basically, it is not easy to understand my AI model once it make it. We cannot able to understand like how the AI model is predicting the output. So interpretability issues is so much many that we're facing. The next one is future trend. Future basically like we are going to discuss like we are going to make an AI model that automatically discover the drugs. We are going to make digital biomarkers, personalized medicine. I think is currently I think maybe in China this is working, this AI robot is working, where I give them my description of my AI like my illness, and my AI model basically personalize my medicine. See, this is the medicine that you can take care. So that is a future trend in the upcoming time that you will see that in AI or data science. So let's see a summary. So what we are going to discuss in this session? So we discussed like clinical data science that improve the healthcare decisions. Important, it is important for diagnosis, treatment planning, and trials. It uses generally machine learning, deep learning, NLP, and stacks that as a tool. And also it ensures that medical compliance. So basically in data science, basically it helped me to improve the healthcare decisions. The decisions should be related to either the medicines, either the business, or either the technical parts. That's some to a doctoral part. Okay. So I hope this summary is clear. Now let me show you one case study. Here I'm showing a data clinical data science based on the our business terms. So let me show you. So for that, this is the one just basic case study. For that, I'm going to use Python. So here I'm showing like how Python is used.
Ashish, Patil here again. Sorry. If you can enlarge the screen for this.
Yeah, I'm
This.
going to do. So first, let me
That's
open
all.
the software. That's
Yeah.
why.
Thank you.
So give me 1 minute. It will take some time to open my software so that I can show you the case study. So here we have given the patient information. We have given the patient ID. The gender is male. Disease was that tuberculosis. Treatment was dialysis. Hospital, that person, that case, City General Hospital. Admission date, discharge date, treatment status, and the cause of death, and the date of birth. So we have given this information. So I want to understand like what type of patients that my that's come to my hospital, what type of treatment that they are taking most of the persons, and is the person is recovered in my based on the like our performance by the doctors or not, like that. So I want to analyze the trend of my data. Basically I want to understand like how the like work is going on. So treatment is going on smoothly or not, is the patients are coming in my hospitals or not. So we're going to analyze this. So we are using some Python techniques here. We are not need to focus on the code. So here you can see with the help of some reports, some charts, we are going to use analysis techniques, that is data visualization technique. So basically trying to understand my data. Here, if I talk about the age group, so in my hospital, I can see that most of the peoples that's come to for the disease, their age is lie between 20 to 80, right? And you can say the maximum peoples is coming from 50 to between 50 and for the 80 category, 70 to 80 category. You can see the peak is higher, the peak is higher is here. So I can see here between 20 to 80, most of the people are coming in this age group in my hospital. So what I can do, I can keep only normal doctors who is taking care of between 18 to 30 age, 18 to 8, 20 to 80 age, because we don't require some child. We don't require need child doctor, because I can see that the most of the person, most of the users or people come to my hospital, their age belong to 20 to 80. So here, hospitals save their time by not recruitment the child doctor, okay, or child specialist. Now, next one is that here I'm trying to find the analysis based on the gender and age. So I found that key here gender is not by the blue color, female not by the orange color. Here I can say gender male have the higher capacity or the high have the higher chances to come in my hospital in terms of your compare with the female. You can see female with the orange. Similarly, I'm trying to analysis like based on the age, what type of the disease that person have. So I can see this is called box plot. I can see 50%. Most of the boxes are same. These boxes are same means that they are saying that ki most of the people have same type of diseases. And I can see that the this is called 25%, this is called 50%, this is called 75%. So I can say 75% data or 75% people are coming from the cancer for and their age category is between 20 or 35 to 70. So I can see cancer, obesity, diabetes, like that. All of the type have equal density in my data. Means if I talk about that, all the diseases, so if I talk the people count, so most of the diseases have same people count. You can see here the people count. So 25 to you can see the size. Most of the boxes have the same size. So I hope this point is clear. How we can use this? Here I'm trying to find the diseases based on the gender. So I found that if I wrote the cancer, obesity, diabetes, asthma, hypertension, arthritis, I can see density is same for male and female. It is not like that male is high, the chances of cancer to male is higher than the female. I can see on my data. No, you can see all of the diseases have same distribution for cancer, obesity, diabetes, and all. So I hope it is clear gender distribution. The next one is that blood type. So blood type and medical condition. So I can see here we have different medical condition people. You can see here. If I compare the medical condition with their blood, so I can see different blood type group is showing in my base. So I can see if I wrote the B negative, so most of the people have higher disease like obesity. If we talk about the A positive blood group, these people have a disease like diabetes, right? Similarly, I can compare with O plus. If I talk about O positive, most of the people have earthy type diseases. If I talk about the A positive blood group, so most of the people have hypertension type disease. So in that way, I can analyze my hospital data that basically help me to solve this business problem is here. Now let's see the average billing amount per medical condition insurance. So if I talk about the medical condition cancer, so you can see in cancer, the average bill amount is around maybe 25,000, right? So you can see most of the diseases have the equal, like around approximate same billing amount average, right? I cannot, you can see here, most of the diseases, like approximate all diseases have billing amount greater than 20,000 and lesser than 25,000. Now, if I talk about the admission type by medical condition, so you can see the cancer, the cancer diseases have elective count. I can see in my data, the most of the admission type for cancer disease is like elective, right? And if I talk about diabetes, so urgent, you can see in diabetes. In my hospital, diabetes people have highly urgent admission type. So I can say I need to keep like diabetes type doctors who can handle it in my emergency ward because most of the diseases, most of the people are coming from diabetes. You can see in the urgent ways. So we have to handle it. You know, guys, because of the diabetes, I can get any like heart attack, like that type of problems in maybe night, in afternoon. So at that time, obviously we need emergency doctor. So obviously we need to keep that doctors that can handle like diabetes type problem. If I talk about the medical condition which is test results, so if I talk about the cancer, this is the test results of cancer. So I can see here in cancer, most of the results are abnormal. In diabetes, most of the diseases are abnormal. But if I talk about the asthma, most of the diseases are like normal. So with the help of the bin size or bar size, I can decide like how the medical condition is going on in my hospital. The next one is medical condition versus medication. So if I do the medication, so you can see most of the peoples in cancer diseases, they are taking lipid type medicine. So lipid type medicine is mostly required in cancer cases, right? In cancer case, we are giving paracetamol, aspirin, penicillin, and Lipton. But I found that in my hospital, in cancer case, maximum medicine is going from Lipitor. So let me keep most of Lipitor because it is emergency and highly important diseases, highly important medicine. If I talk about the obesity, in obesity, penicillin disease is highly, sorry, penicillin medicine is highly required. You can see here in obesity case. So similarly, I can see different of medicine. You can see arthritis. In arthritis, we required most of the people are required aspirin medicine. Okay. So these type of problems that we can solve with the help of data science in business field. So what we have learned in this session, so we have discussed like how data science is used in different field. It can be used in normal business field as well as technical field. So we also discussed what are problems. Here we also see the one case study of business of a hospital, like whatever medicine is required, whatever disease is mostly required in my hospitals, like that. So that's all for guys for this demo, the sessions. I hope you got it every point. Now this is the question answers part. So let me know if you have any question.
Okay, thank you. Thank you, Ashish, for taking this session and walking us through the tools and techniques and the real world applications for clinical data science using Python. So if there are any questions we get, we'll try to share it with you later and we can get back to them with those
Sure.
answers. So thank you very much for taking time out and doing this session for us. Thank you and have a good day. Thank you, everybody, for joining us on the call.